Welcome to this exciting new episode of the Wonder Tooth Podcast. Today I am going to talk about implants, dental implants. What are they? What is the procedure like? Why do we need to put implants rather than other options? And what are the complications and how the whole procedure is basically done, and the maintenance at the end. So if you like this episode, do not forget to subscribe, like, and share, because in my channel, let me tell you a little bit about myself. My name is Dr. Radwa Saad. I am a dentist with over 20 years of experience. Yeah, well, I have good genes. So, but I also did a lot of dentistry throughout my life. I am licensed to practice in the United States as well as in Canada. So I went through intensive training. I am also the past president of Mercer Dental Society. So basically we make seminars and courses for the dentists in the area. And also I did like extensive amount of CE, and I have a master's degree in implant dentistry, and I also created or built the most luxurious dental spa in the United States. So I think I can really talk about dentistry. So make sure you subscribe and you follow our channel, because I'm also gonna share a code which is for this time is DENT, DENT 47, and this is to get a free consultation for implants. So make sure I'm gonna put the code again in the description, and we can always do a virtual consultation if you check the link in the bio. And let's talk about implant dentistry. So first of all, what is a dental implant? So implant is basically like we put a root in your jaw. We put an artificial root in your jaw, and it's like a tiny little metal screw that we put in the jaw. And why do we do that, and what are the indications for that? So sometimes some of the teeth can fail for whatever reason. You bite something hard, the tooth cracks, it's not restorable, we cannot do a root canal, or the root canal fails and the tooth needs to be extracted, or bad decay that's all the way under the gum line, we cannot restore the tooth, so we have to pull the tooth. So now the tooth is out, we need to put something instead. And what if we don't put anything instead? The other teeth or the remaining teeth, they're gonna start to shift. So the back teeth or the more front teeth, they're trying to close the gap. And the opposing teeth are gonna start to over erupt to close the gap as well, which is basically down the line is going to affect your chewing ability, your occlusion. And that can lead to more problems in the future for the rest of your remaining natural teeth. So the implant is a good option. A bridge sometimes is another option too, and the bridge, unfortunately, we have to shave natural teeth to make them a little smaller to be able to fit the teeth, on the top. And basically, it's like putting a crown on the natural tooth here, natural tooth there, and it's a framework, and they're holding a tooth in the middle or two teeth in the middle, and it's glued on your teeth, so it's fixed. So this is what a bridge is. Implant is different. Implant, we put the little screw in the bone and then we build on it, so we don't touch the two teeth on the side. And also a flipper is an option. It's a removable fake tooth. It's the cheapest option. It's not really highly recommended because anything removable with time, the friction, it can cause the gum and the bone around the natural teeth on the side to resorb and shrink, and then end up with even bigger problem that those two teeth might end up falling. So what is the implant? As I said, it's a tiny little screw that we put in the bone. We get it from Home Depot, okay? I'm just joking here. I had a patient the other day and I was putting an implant, and I said, well, yesterday I did a really good shopping at Home Depot, and he was like, what? And I said, yeah, I get this little, and he was like, ew, ew, and I was just laughing, and he thought I was serious at the beginning. It was hilarious. We laughed about it, and he was, I showed him the pack. I was like, okay, it's not really Home Depot, I'm just joking. By the way, Home Depot, when I'm done with dentistry, when I'm ready to retire, which is like probably never, I'm gonna work part-time there. I love their tools. It's like our bigger tools, believe it or not. Anyway, back to talking about the dental implants. So the implants basically, as I said, it's a small artificial root that we put in the bone. And number one now is gonna be, I have to make sure that the patient is completely informed of what he's stepping into. So the first thing, I have to bring the patient in for a consultation to make sure if we have enough bone to put an implant, yes or no. And that's also why it's very important, if you are planning in the future to have an implant placed and you have a tooth that needs to be extracted now, ask your dentist about a bone graft and a membrane, because that's going to save you a lot of money down the line. And what is that? So basically, when the tooth is pulled, the bone around it starts to collapse. This is remodeling. This is the natural healing of the teeth. So the bone starts to collapse and basically try to close the gap, and then it becomes smaller. So there is not enough thickness or height of the bone so that, you know, we can try to put an implant. There is nothing left. So a bone graft is basically when the tooth is pulled. If you're not planning to have the implant placed immediately, we pack some bone in and then we put a collagen membrane on top and stitch over it to preserve that height and thickness of the bone, basically, so that when, you know, you decide a few years after that, okay, now I'm ready for the implant, you have something to work with. Because the alternative would be, okay, I don't want to get a bone graft, the bone is gonna collapse, and now what's gonna happen, you're gonna need an extra surgery to add the bone, and sometimes we put it in on the side with some screws, or if it's close to the sinus, we have to do a sinus augmentation or a sinus lift. So first step is to bring the patient for a consultation, so we check the bone. And how do we do that? We take first a small x-ray, you know, the little digital x-ray, and after that we have to take a CBCT, which is a 3-dimensional x-ray. It's the big, you know, panoramic x-ray, but then it switches and becomes a CAT scan. So the CAT scan can basically show everything. We can do our measurement. We know where the floor of the sinus is here, the nasal cavity. We know where the nerve is. We can do the measurement, the width of your bone. We can do the measurement and basically decide where is the optimal position where we're gonna put the implant, if we can put it. And after that, if things look good, there are 2 different ways of doing it. So I like to scan the teeth, which is the 3-dimensional scanner, the 3D scanner, to scan the teeth, and then I put it together. I merge it into the CBCT or the 3D X-ray that I have. And this is now, we're going into completely digital dentistry, because I can put them together and then I can design something called a surgical guide. And what is a surgical guide? This is what we call flapless surgery. So I do this, and I also do the regular, okay, we're gonna open and, you know, put a little implant and put some stitches afterward. But the flapless surgery is basically when we merge both the 3D X-ray with the 3D scan together, and then we can check all the significant structures, the important structures, the vital structures, and we can design where exactly the optimal position of the implant, and we can virtually put a crown on top of it so we can see how it's gonna look in the mouth. Then we designed the surgical guide, which basically is like a little plastic piece. It looks like half a night guard, kind of, you know what I mean? And at the day of the surgery, we put it on your teeth, and that area where the implant is gonna go has like a small hole, and this is where we drill through it basically to put the implant in, and then we put a healing abutment on top of it. So this is one way of doing or placing implants. The other way, okay, the old way is, okay, we take the 3D, we know how it's done, especially if it's not too complicated. It's very easy, like, you know, we have enough thickness and bone looks good, and, you know, we're away, we know exactly how the height of the bone, and we know the length of the implant, the thickness of the implant, so we're good to go. So basically we do a little surgery, tiny, of course you get numb really well, And we have to make sure before any of this that your medical history is also okay, that you're not taking any medications that can interfere with, you know, the healing, or you're taking like steroids, or you're taking blood thinners, anything that you have to tell your dentist, obviously everything before the surgery, the date of the surgery. Then we numb you really well, and then we just do a little tiny flap, and then we kind of reflect the gum, and it's easy, straightforward. It sounds scary, but it's not. It really is not. It's like doing a root canal, but we do it in the bone rather than in a tooth. So we just start to drill. We take usually a couple of x-rays during that just to make sure the angulation looks good. Then once everything, and it doesn't really take long. If the bone looks good, if the position looks good, usually 15-20 minutes you're done, believe it or not. The more complicated ones are usually the one that I like. It's like the same day immediate implant placement. Of course I do this, but I also do that. And what is the immediate implant placement? So as I said, I have to take a CBCT, and let's say it's a front tooth. Oh my God, the patient is now scared because how am I gonna, and I've had these so many times, what am I gonna do? I can't walk like this, I can't go to work without a front tooth. So if the tooth needs to be removed, I check the measurements, and then if we have good bone surrounding it, we can pull the root, we can place the implant, then we put bone around it, then we put a little membrane on top of it, and then usually I would put like an extra tooth, like a fake tooth, kind of attach it to the two teeth on the side. Or we can make like a little, I wouldn't use a flipper, but we can do like an Essex retainer with a little tooth in there. And then the patient leaves with, you know, teeth, you know, smile. Of course, you're not gonna bite on this until we are completely finished, but at least you have a tooth. So once the implant is in, we before I even am completely done, we stitch and close. And now there are different kinds of implants. So there is the implant that goes in the bone, all the way down in the bone, which is called endosteal, like it's all the way in. Then there is the subperiosteal, which is like a tiny little bit on top of the bone if you don't have good enough bone, or you don't want to go deeper, and then you might hit any of the vital structures. And then there is the zygomatic. The zygomatic, it goes all the way in and back here in the zygoma if you don't have enough bone structure on the top here. Once this is done, we stitch, and we take another 3-dimensional x-ray to make sure completely that the position looks good, the bone looks good, we are away from, just to kind of, okay, you know, after you do the work, you take a post-op, you have to make sure everything looks fantastic, and that you are away from any major structures. We always like to stay at least 2 millimeters from like the nerve or from the floor of the sinus. Sometimes even the floor of the sinus, the cortical bone, which is the floor of the, it's nice to kind of stabilize the implant there. Once the implant is in, before we stitch, we can also check with a little gadget the stability of the implant, just to make sure it's gonna be okay. Then we stitch, and then I give the patient antibiotic and a painkiller. And usually if the implant is on the top here, I usually tell them to take an allergy medicine, antihistaminic. And why is that? Because I don't want them to start sneezing. I don't want anything that can disrupt the implant from, you know, from the place, because once you start to sneeze, that can create a negative pressure in your mouth, and then we can end up, you know, affecting the healing. Steroids also can be a big, has a big tremendous effect on the healing of the implant, because it affects the healing in general. So you have to tell your dentist all the time about all the medication, even if it's a medication that you started like a week ago and, oh, I forgot. Please, you have to give them a full list of the medicine, of the medications you're taking. So now the implant is in, you go home, you have now your antibiotic, you have your painkiller. Sometimes I would give, you know, like an extra, you know, narcotic for like a couple days really. And then we stitch. The stitch is not self-dissolved, so you have to come back in 2 weeks to remove it. And I like to do it that way because I want to make sure everything is healed up to the point. And then of course you shouldn't really brush that area the day of, but following day you can start to brush gently. Pain, there is really hardly any pain with the implant. In my opinion, pulling teeth, it's much harder than putting the implant in. And this is out of an experience of 20 years of experience. putting an implant is not as hard or difficult as pulling teeth. This is my personal opinion, and I'm pretty sure a lot of dentists would agree with me, because sometimes, you know, if that root is like doesn't want to be removed, it might take you like an hour or even more. But the implant is like in and out, especially if you do your homework before with the CBCT, and you know exactly where you're going and the size and the angulation, and you're good to go. Basically, that's 50% done outside of the mouth. The other 50 is when you basically put the implant in and you stitch and you're done. So now the implant is hidden in the bone, but there is nothing on top of it. If it's in the back, really all the way in the back, you don't really necessarily need something on it. But if it's in the front in your aesthetic zone, then definitely we need to put a tooth or something. I am not really a big fan of putting an immediate crown. So I've done it before, but sometimes it can affect the healing of the implant. And why is that? Because people, okay, I have my tooth now, and then they start to bite on it. They're not supposed to. So that can start to affect the healing of the implant in the bone. We call it osseointegration. So we need to really keep I tell them I need that implant to sleep. I want the implant to sleep in the bone for at least 4 months. That's it. So I don't want any pressure at all on the implant. We don't want to activate it. So that includes also a flipper. Some patients, they will come with a flipper, and if the flipper is not actually adjusted properly, like basically when you bite on it, I don't want the inside part of the flipper to hit the gum where the implant is. Otherwise, it will put pressure on it and will affect the healing. So this is a very big no. So what are the other alternative would be maybe put an acrylic tooth like in the middle and kind of attached or even splint it with the other teeth, natural teeth on the side, or have an Essex retainer. And this is basically like, you know, the aligners, and we just put like a little fake tooth and you smile and you have a tooth. You just don't eat with it, and you just have to eat soft food, obviously for maybe a couple of weeks before, just to make sure the area is not touched. And you don't bite at all on that tooth at all, especially if you have like a little fake tooth. So this is number one. Number two, you come back usually after 2 weeks to have the stitches removed. And also, you know, we take a little x-ray to make sure everything is okay. No symptoms, no problems, no pain, no discomfort. Of course, it's very important if you start to feel pain after the implant was being placed. And I'm talking just not a little bit of discomfort is okay. You know, it's a small surgery, but pain like, oh my God, numbness or severe pain or something going on, you have to talk to your doctor. Like you have to call your doctor. I would just go directly to the dentist the following day and say, you know, what's going on. And this is exactly why we take a 3-dimensional x-ray after the implant is placed, because I have to make sure that it's far from any vital structures. Thank God we didn't have issues, but I have heard of issues when, you know, okay, you know, it went a little bit deeper, it kind of touched the nerve, and now the patient is excruciating pain or there is numbness. So we don't want that to happen, and that's why I always say the best is to get a 3-dimensional, or go to the place, if you're gonna get an implant, go to a place where they have the 3D x-ray. We have it in the office if you ever need it, but we just before the surgery and right after the surgery to make sure everything looks good. Okay, and now the implant is in. What do I do after? Okay, now you're taking the antibiotic, your painkiller, you're taking your antihistaminic if you have, you know, the implant in the top, but then what else? 4 months. I also want you to take calcium and vitamin D, because now we need to give a little boost for the bone cells. I want them to go and basically love the implant. I want them to build around the implant. When we take a small x-rays, I want that implant has little threads. I want to see bone in those little threads. That's what we call osseointegration. So we want to see that okay, the bone loves the implant. We're happy now. Let's restore it. Then what happens after? So usually between 4 to 6 months after the implant is placed, we'll bring you back, and then we make a tiny little like a little punch in the gum, little tiny, we numb you of course, a little bit punch in the gum, and then there is a tiny little screws that goes inside the implant. We remove that little screw, we put a bigger screw. What is that called? It's called the healing abutment. And what does it do? So basically, you know, the gum was covering the implant completely. Now I need I need it to look like this. Like the implant is in, then now it's starting to show through the gum. Your tooth doesn't come like this. It comes like this. It has a little curvature, right? It has like an emergence profile. So I need to give the tooth this. So how do we do that? We put a bigger screw that's basically gonna push the gum a little bit like outside. So when we start to restore it and put a tooth, it looks beautiful and looks like a natural tooth. So that's a healing abutment. And usually we keep that in around 3 weeks. Of course, you have to brush, you have to clean, you have to rinse with warm salt water, you have to keep the area completely clean, because when you come back for your skin, or if we're gonna take impression, once we remove that little screw, I want the gum to look nice and pink and healthy. If it's bleeding, it's gonna be very hard to restore that on that day. We're probably gonna have to put the healing abutment for another week or two. Just do yourself, a favor and keep it clean. How we do it in the office, we can restore on the same day because we have the technology. Okay, we're very high tech. So how we do that, basically you come in, we took that little healing abutment, then we start to scan. It's a little digital scanner, copy of the, of the area, and then we put a little something, we take a little x-ray, little rubbery thing, we scan it again, and then we start to merge them together, and then we start to design the crown. And now you're sitting in your chair for maybe another half hour to an hour while we make the tooth that's gonna come on top of the implant. How it's done. So we put a part underneath it that's called the abutment. So it's like a metal part that sits, it gets screwed inside the implant, and that's called the abutment. And then the crown comes on top of that. Now, there are two different types of crowns that we put on top of the implant. There is the cement retained or the screw retained. So the cement retained is basically, we usually like to use it more in the aesthetic zone if the implant is pushed more forward and the screw is gonna show from the front. You remember, the implant is like this and there is a screw that goes in it. If the implant is like this way, so the screw is gonna come through the front of the tooth. So now we have to fabricate a custom abutment, which is, if the front, we're gonna do a porcelain one. So a porcelain piece, okay, that looks like a smaller tooth. We screw it in, and then we fabricate, we mill a crown and we cement it on top. So basically it's not showing. So this is what we call a cement retained. Then the screw retained is much better in my opinion, and in a lot of the literature actually, because we don't really touch anything around the gum line. So the cement that we put sometimes can go a little bit of extra under the gum line, and it can also affect the implant. So the screw retained is much better. And how is it done? So there is a little metal part that goes on top. We screw it inside the implant. It's called the abutment. So that abutment, or a tie base, we can fabricate a crown, and the crown has a hole in it. We glue it on top of that, outside of the mouth, on top of that abutment on outside. So we are able to clean the outside, but now there is a hole that goes through the crown and also through that abutment. And we put it and we screw it in, and now that crown on the top part of it, or the biting surface, has a small hole, and we usually have to put a tiny piece of tape, because that screw, we don't want to touch that. So we put a tape after we torque it, put a little tape, and then we fill it with a white filling. And then we take an x-ray to make sure everything looks good. We adjust the bite. Usually with implant crowns, we don't want heavy bite on them. We just want like light, light occlusion. Then we take a little x-ray, make sure everything looks good. And I always like to bring the patient back after 1 month to make sure, like another x-ray, make sure everything is okay. Now, if the patient grinds the teeth, you have to wear a night guard. It's not even an option. You have to wear a night guard. And why is that? Because your natural teeth can give in. There is a little periodontal ligament, they can give in. Now, let's say the top part of the teeth, the natural teeth, is wearing off. The implant is not gonna wear off. Like, it's not gonna be worn. And not what we're gonna do. What's gonna happen, the bone cells, the beautiful bone cells, the osseointegrated on the top part of the implant, is gonna start to actually come down. And why this is happening? Because you didn't wear your night guard. And now you go to your dentist and you're upset. You didn't wear your night guard. You have to wear your night guard. That's one. Two, I'm talking now about the complications. Two, cleaning. brushing is important, but flossing is extremely important around an implant. And why is that? Because the implant has now a very small neck compared to the natural tooth. Your natural tooth, you know, there is a root and then the tooth comes, so you have a wide neck. But the implant, it's a very narrow neck, and a water pick alone is not gonna get there. So you have to put the floss, make sure it actually reaches all the way deep down towards that neck, and you pull it through, and you have to do this like a couple times. There are thicker floss like cocoa floss or whatever floss, super floss, or you can even, the floss that you're using, make a double, and you have to floss, clean properly, pull it through, rinse it and put it again in the same area and make sure it's super clean. Then after that you can use a water pick to clean. But a water pick alone is not enough. Not using a night guard is not enough. Okay, this is very important, guys. Sometimes in very rare very rare conditions, if the patient has a problem in the healing, or the patient was, sometimes chemotherapy can affect the healing of implants too. So that's why for a dentist, you have to cover yourself and make sure you connect with the medical doctor or, you know, the treating doctor to make sure the patient is okay to get implant placed. For example, I have a patient coming this week on a bunch of medicines, so I had to contact the primary doctor, the cardiologist, the urinologist too, the urologist, to make sure if there are certain medications that we have to keep off of it, and then, you know, the regimen, basically how we're gonna do this, if the patient needs to be pre-medicated too or not. So once the implant is in, the crown is on it, it's very important that you maintain it like a natural tooth, but with more like due diligence. Basically floss, as I said, every single day. Implants, they don't get cavities, but they can get gum disease all the time. And if you have gum disease to begin with, implant is really not a good option for you. And I'm being honest, because if you didn't care for your teeth and you have gum disease, and now we're putting an implant and you're not caring for it, then it's really due for, it's gonna go, it's not gonna stay, it's gonna fail. So night guard, brushing, flossing, and of course, you know, get your dental checkups. I would probably get an x-ray of that implant, you know, once a year, just to make sure everything looks good. Okay, so we spoke about the different process, you know, the process of the implant, the different types of implants, the one that goes in the bone, the one that's subperiosteal, then there is the zygomatic. There is also a new, it's not really new, it's been out there for like a few years now, the zirconia implants. I am not a big fan of it at this point, because the literature, there is not a lot of literature yet. But it's really for people who are, they don't want titanium in their mouth, and they're very, you know, they have like medical problems. They don't want any metal in their mouth. So, you know, I usually would sell them to like, you know, holistic dentists to, you know, to take care of them. It's the same exact concept, but just a different type of implants. The one that we use are the titanium. There is a lot of literature about them, and we use them all the time without problem. The zirconia is mostly holistic, and it's, you know, if you don't want metal, it's another option as well, until I'm pretty sure like the literature, because I don't want to put something and then it doesn't really take, and then what's we're gonna do after that. Complications, yes, very implantitis, which means inflammation around the gum, around the implant, and that can happen if the bone on the bottom part of the implant can be integrated, but the top part, if you're not flossing properly, if you are grinding your teeth, and if your occlusion is not proper, or if you are like completely clenching, grinding all the time, that's gonna happen. The bone on the top part of the implant is gonna start to disintegrate or basically shrink. But the implant is still integrated. So sometimes what we do, there are different options with this. There are certain procedures that we can do to keep the implant if you still have like a long enough implant integrated. Okay, so this is one of the complications. Another complication, if the screw inside the implant breaks, that's a nightmare, big nightmare. So of course, when that's not your fault though, this is the dentist when they are torquing the screw, the tiny screw in, they go a little far, like a little too hard, and then it cracks. That's a big problem. Another big complication, and I've seen it once, I've never seen it actually just the one time. I had a patient, she had a whole like a roundhouse, like a big bridge on her top teeth, and it was failing. I didn't do it. It was failing, but they connected natural teeth with the implants. So the implant was holding the natural teeth. Now the patient having seen the dentist for many years, so the natural teeth now were breaking and they were failing, and there was decay underneath it, so it worked like a little cantilever. The implant was holding them until the patient bit something hard and the implant itself cracked. That was really something, yeah. But you know, that's why as you need to go get your 6-month checkups and cleanings. You need to have the x-rays done, please, because you know the dentists, they don't have x-rays in their eyes to tell you, yeah, you're good. Please, I know some patients, they don't want x-rays, you know, to be, but we take x-rays to make sure we can diagnose things properly, please. And you have to do your due diligence basically at home, brushing, flossing, remember, with the thick floss all the way till the neck of the implant to make sure it's clean. Wear your night guard. And if you have tongue thrust, you know, like people sometimes have tongue thrust, they start to push with your tongue, and then they start to see like little spaces between, especially the bottom teeth, and it start to push around there too. So that has to stop. And how do you stop that? By wearing a night guard to stop, you know, to keep things in position. Okay? I hope that was informative. It was a lot of information today, but I hope it was informative. I love implants. I mean, it's a really interesting subject, and it's a very important service that we can provide to our patients on the same day, most of the time, but sometimes also we can do it, you know, according to if they want to wait on it a little bit. But when you have the proper technology and you have the proper experience, it's worth it. And make sure if you're gonna get implants to go to somebody who is experienced. And of course, make sure to take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Make sure you write comments, or if you have any questions, please send us the questions in the show notes or in the comments, and subscribe and follow, and I'll see you next time. Have a good one, everybody.